I'm Hiva Fassihi, consultant dermatologist at Welbeck, and I'm here to go through some of the most common questions that patients ask me about rosacea. So what is rosacea? Rosacea is a very common inflammatory condition of the skin. It affects the central face, where patients can develop broken blood vessels and redness, as well as small bumps and pus-filled spots. It is more common in women, but when men develop it, it can be more severe. So what causes rosacea? The exact cause is unknown. However, there seems to be a combination of a genetic predisposition, environmental triggers, but also an immune dysfunction where there's increased inflammation of the skin. The theory that the Demodex mite on the skin or even bacteria on the skin and the gut might be involved has not been proven, but patients with rosacea are known to have an impaired barrier of their skin, so the skin often feels very sensitive and hot and red at times. What are the common rosacea triggers? The most common trigger for rosacea is ultraviolet radiation. So patients must be very, very careful with the amount of sun exposure they receive on their skin. Other triggers include excess alcohol, hot spicy foods, and even environmental effects like a change in temperature, and stress can definitely contribute to rosacea flares as well. Patients often ask me if their rosacea can be cured. The honest answer is that there is no cure for rosacea, but we have some very effective management, so you can significantly improve the appearance of rosacea with the treatments we have. Does rosacea get worse over time? Rosacea and its severity can fluctuate from time to time. It is known that if you don't manage your rosacea symptoms well, there is a risk of it progressing and becoming worse. So again, it's really important to see a dermatologist and get good advice about the management of your rosacea. How is rosacea treated? There are lots of very effective treatments for rosacea, so if you do have rosacea, please see a dermatologist and get good advice on how to manage your condition. Firstly, there are topical treatments. There are a number of anti-inflammatory creams that can be applied and can effectively manage rosacea, particularly if it's on the milder end of the spectrum. If your rosacea does not respond to this, we also have oral treatments. These are often low-dose antibiotics, which act in an anti-inflammatory way to reduce some of those red spots and the pustules that we see in rosacea. The redness that we see in rosacea can respond to some degree to the creams and the tablets, but if they're true broken blood vessels, then laser treatments can be very effective. So you can use IPL and other forms of laser treatments to manage the redness and the broken blood vessels in rosacea. If rosacea is very severe, we can even use medications like Isotretinoin. This can be used in teenage acne, but in very low doses can also be very effective for more severe rosacea. And if you have involvement of the eyes, it's really important to see an ophthalmologist to get further advice on how to manage ocular rosacea. So if you are concerned about your rosacea, please make an appointment and come and see a dermatologist at Welbeck.